Good morning, my name's Caleb. I'm gonna be your student physical therapy assistant. I'm from Owens Community College. Um, Looks like in the past you've suffered from some methamphetamine and intravenous drug use. You're currently in here today because you suffered a middle cerebral artery aneurysm that resulted in right-sided weakness. This is possibly due to your mitral valve replacement that you recently had. Today we're going to transfer you from edge of bed to wheelchair. We're going to educate you on your stroke and some of the symptoms that you're having, and we're also going to educate you and your caregiver on the use of your quad cane. For the education on the stroke, a stroke happens when part of the brain doesn't get enough blood and oxygen. When that happens, the brain cells in that area start to get damaged. In your case, your stroke was caused by a problem with a blood vessel in your brain, and it's called an aneurysm, which your middle cerebral artery started to bulge out. This area of the brain controls your movement and coordination. Because of this stroke, you may experience things like weakness or paralysis to the right side of your body, and also some problems with coordination and balance as well. It's very important that throughout therapy you use your right side as much as possible to help your brain to relearn the movements and build up the strength on that right side. Do you have any questions before we get started? Okay, Ben, so today we're going to be transferring you into your wheelchair. So the way the steps will go, I'll have you scoot to the edge of the bed, and I'll be here. You can stay there for right now. I'll be here, and then we'll slide over as much as we can and get you positioned to get in your wheelchair. Make sure you keep your feet on the floor, and then you'll also need to bend over to help yourself stand up. And if you feel like you can use that right arm, you can go ahead and try and grab this, but if not, you can keep it into your thing. And the wheelchair is locked. Cut my arm off, so you should be all good. So you can go ahead and scoot to the edge of the bed, lean over. Yep, there you go. You got your feet on the floor, so then on the count of three, we'll scoot over. So 1, 2, 3. Good. We'll scoot over one more time. 1, 2, 3. There you go. Get yourself repositioned. And then on the count of three, I want you to bend over and stand as much as you can, and I'll help guide you to the wheelchair. So 1, 2, 3. Good. There you go. Okay, so this intervention is going to help you with your core stability and your upper extremity coordination. So what we're going to be doing essentially, so I'll have this out here, so you have to bend at the core here and lift, and then set it here. So you're doing here, lifting up, and then staying it there. What I want you to do is keep your back as straight as possible, so you're bending over at the waist, and then think of activating your stomach muscles as much as you can, and then up and over. What I don't want you to do is to bend over and slouch your back like this and then just move it over, because you're not really using your core at all. So I'm going to make sure that you're up. So I'll do 3, so it'll look like this. So back here, up. That's 1, and then you can go here to here for 2, and then here, there for 3. Does that make sense? You don't have any questions?
No question.
So what that's working on is it's getting coordination in your arm, and then working those ab muscles. I'll go ahead and put this over, and once you do it, and I'll go behind just to make sure you. Okay, you can start. Make sure you really reach for them. Good. Okay, before we start walking with your cane, we're going to apply your gait belt. Are you familiar with what a gait belt is?
No.
Well, we're going to put it around your waist to make sure that it keeps both you and I safe while we're walking. Do you have any wounds, tubes, or lines?
No.
Okay, do you mind if I put this around you then? want it to be snug, but not too tight. How's that feel? Good?
Good.
Breathe all right?
Mm-hmm.
Okay, so now I'm gonna educate you on how to use your quad cane that you have. You wanna make sure that it's in your left side, so because your right side is weak. So we're just gonna be using a 2-point gait, so you're gonna take a step with your left and use your cane as well, and you can use that for extra balance and bringing your right leg up. So again, step, and bring your right leg, step, bring your right leg. Does that make sense? Okay, and then to guard you, so for your caregiver, I'm gonna go ahead and have you stand up. There you go, have this in your left. The caregiver, you always want to be on their weak side with your hand under their gait belt, and you can also have a hand up here to help make sure that they balance, so you can go ahead. We'll kind of turn this way. So you can go ahead and use that left foot good, and bring it up. Just make sure you have a hold of the gait belt the whole time and that you're keeping them on balance. Do you have any questions for me?
No.
Thank you for your time. If you have any questions, you can contact my phone number or email me.